Hello, my name is Hilda. I'm a nurse practitioner student. I'm here to do your complete physical exam. The medical assistant has already taken your vital signs as well as your height and weight. Your blood pressure today was 122/80. Your heart rate was 65. Respiratory rate was 18. Oxygen saturation was 98%. Your temperature was 97.8. Your height was 5'10". Your height was 250 pounds for a BMI of 31.3. Throughout this exam, we will be inspecting different areas of skin on your body. First, we will start by inspecting your face and also inspecting your head. And we will also be palpating your scalp. And we're looking for any nits, lesions, or scars. Then we will move on to cranial nerve number 5, which is the trigeminal nerve. Go ahead and clench your jaw. Okay, I'm going to ask you to remove your glasses. And I'm going to test you for sharp sensation versus soft. Close your eyes.
Sharp, right forehead. Soft left cheek. Sharp right jaw.
Okay. We'll also test you for cranial nerve number 7, which is the facial nerve. So I need you to raise your eyebrows, scrunch your brow, squint your eyes, and then don't let me open them. Also have you smile, frown, purse your lips. Okay. And we'll be moving on to your eyes. First, we will start by inspecting your eyebrows and your eyelid skin. No inflammation, redness, or lesions there. We'll also look at your conjunctiva, making sure that's pink bilaterally, and we'll palpate the lacrimal apparatus for any tenderness or swelling. Then we'll test cranial nerve number 2, which is visual acuity. The nursing assistant has already tested your visual acuity, which was 20/20 corrected. We'll also have you hold this 14 inches from your face, and I need you to read that for me.
Lock and unlocking your waffle maker. Your waffle maker is unlocked when the side, the 2 indicators are facing up, and is locked when the 2 indicators are facing down.
Your near vision is also intact. Now we'll test your peripheral vision by confrontation. So I want you to tell me when you can no longer see my fingers.
Now. Now. Now.
And your visual fields are intact in all 4 quadrants. Next, we'll move on to cranial nerve 3, 4, and 6 for extraocular movements. We will start with your 6 cardinal fields of gaze. So follow my finger. And also going in, your eyes should converge and accommodate. Also, we will do the cover-uncover test. Look straight ahead. And we'll cover one eye at a time, looking for any lag or nystagmus. Okay. Then we will move on to inspecting your pupils as well as your corneal reflex. We're going to dim the lights. Okay. Dim the light some more. Okay. And I see the corneal light reflex is at 3 o'clock in both eyes. Then I will check your pupil constriction, and both pupils constrict from 3 to 2 millimeters. We'll also look at your red reflex, which is present in both eyes. And then we're going to go ahead and take a look at the back of the eye. So I will use the opposite eye. And we're looking for the cup, that the cup to disc ratio is 2 to 1, that the background is pink, that there is no AV nicking, no cotton wool spots. We'll move laterally to the macula, and no abnormalities there. Same with this side. Looking back, the cup to disc ratio is 2 to 1. No AV nicking. Pink background. Moving laterally to the macula. No cotton wool spots or abnormalities there. Are you okay?
Mm-hmm.
Let's turn the lights back on. Okay. From your eyes, we will move to inspecting your ears. First, we will inspect your ears visually as well as lightly palpate, looking behind the ear and pulling on the tragus. Any tenderness there?
Okay.
Inspecting, lightly palpating. Any tenderness there?
No.
Then we will look inside the ear. I'm going to pull back and up. We're going to visualize the tympanic membrane, which is pearly gray. The cone of light is at 7 o'clock. I can see the handle of the malleus, and the canal has no obstructions. Pulling back and up. Visualizing the tympanic membrane, pearly gray. There's no bulging or erythema. The canal is clear. Cone of light is at 5 o'clock, and I can see umbo. We'll move on to cranial nerve number 8, which is auditory. I'm going to stand behind you, and I'm going to whisper a word while I cover one ear, and you're going to tell me what it is.
Blueberry. Orange.
Okay. And if we had a tuning fork, we would be testing, we would be performing the Weber and Ryan exams. The Weber test, we would strike the tuning fork in place at the center of the skull, and the patient should hear vibrations, should feel vibrations in both ears equally. Any obstruction, any sensory motor obstruction will lateralize to the healthy ear, and any conductive loss would localize to the unaffected ear. The Weber test, the Ryan test, the Ryan test, we would strike the fork, place behind the mastoid process, and we would measure in seconds the amount of time that the patient can feel the vibrations, and then move in front of the ear to the amount of time that they can, the amount of time in seconds that they can hear the vibrations, and that should be a 2 to 1 ratio. And that would be performed on both ears. Let's move on to your nose. I want you to tilt your head back some. And I'm going to press on the nose just about 1/4 inch. I'm looking inside each nostril. The narrows are pink. There is no obstruction. There is no discharge or lesions. Pink turbinates. No swelling, no abnormality there. And we will test cranial nerve number 1, which is smell. I'm going to ask you to close your eyes and include one nostril at a time. And tell me what you smell there.
Rum.
Include the other nostril.
Orange.
That's correct. We'll also inspect and palpate the nose, the frontal sinuses, and the maxillary sinuses. And there's no tenderness or redness there. We will be moving on to your mouth. So we're going to inspect your lips, lightly palpate, no lesions or sores there. And we'll look inside your mouth. Open your mouth. I'll look at the teeth, the gums, and the mucosa. No lesions or sores there. I do see some dental caries that have been repaired. We'll test cranial nerve number we will be testing cranial nerve number 9 and 10. So go ahead and open your mouth and say ah.
Ah.
The uvula rises, is midline and rises. Both tonsils have been removed. Lift your tongue up. No lesions and sores there. And then we also want to test cranial nerve number 12, the hypoglossal, by asking you to do some movements with your tongue. So stick your tongue out, up and down, side to side, and press against your cheek. Also, testing cranial nerve 9 and 10, I would ask you to swallow. And if we were in office, I would test the gag reflex with a tongue depressor. Okay. We'll move on to your neck. Let's inspect in your neck and lightly palpate. The trachea is midline. I don't see any obvious goiter. We'll lightly palpate the thyroid gland, and there's no enlargement or nodules there. And let's palpate your nodes. Cervical nodes, preauricular, postauricular, occipital, superior anterior cervical, posterior deep cervical. Shrug your shoulders. And supraclavicular, no swelling or immobile nodules there. Also, shrug your shoulders. And against resistance, that's testing for cranial nerve number 11. We'll also ask you to make some movements with your neck. So, bring your neck down, back, side, side, and then tilt to the side. And again, against resistance. So, back, front, side, side, and tilt your head. Okay, that cranial nerve number 11 is intact. We're going to be moving on to your chest, so I'm going to ask you to remove your shirt. We will start by inspecting the skin and also lightly palpating the skin for any thrills or heaves. Nothing there. Let's move on to auscultation. We will start by auscultating at the apical pulse with the diaphragm, which is located left of the sternum, mid-clavicular at the 5th intercostal space. And I hear S1, S2. Go ahead and lean forward. I also hear a diastolic murmur with varying quality. And we'll move on to auscultating the other fields. So we will start with aortic, right of the sternum, second intercostal. Pulmonic, right of the sternum, second intercostal. Erb's point, left of the sternum, third intercostal. Tricuspid, left of the sternum, fourth intercostal. And mitral, left of the sternum, midclavicular, fifth intercostal. And we will do the same with the bell. The bell has can pick up higher frequencies. Aortic, pulmonic, Erb's point, tricuspid, mitral. And I don't hear any extra S3 or S4 gallops. Okay. We also want to palpate your carotid pulses. So we'll do that one at a time. That's bounding and regular. Bounding and regular. We'll also auscultate for any bruits or any radiation of the murmur. Hold your breath. We'll use the bell. And breathe normally. That completes your cardiovascular exam. I'm going to ask you to turn around. And we're going to inspect your posterior thorax. We'll also lightly palpate. We're looking for any scars, bulges, or abnormalities. And I do see 2 scars here from a congenital ventricular septal defect repair. I want you to take a deep breath. And the chest rise, the chest expansion is equal and symmetric. Also going to palpate for tactile fremitus. Say 99.
99. 99. 99. 99.
And that's all equal over the air-filled chambers. We'll test for costrovertebral tenderness at the level of T10. Any tenderness there?
No.
Okay. And then we're going to percuss. And we're also going to measure diaphragmatic excursion. So in the air-filled chambers, percussion should be resonant. And let's measure your diaphragmatic excursion. So take a deep breath and hold it. Okay. Breathe normally. And take a deep breath, exhale, and then hold. That was 5 centimeters, which is within normal range. And then we will auscultate lung sounds. Deep breath. And both lobes are clear with no adventitious sounds. Go ahead and turn around. We've already inspected the skin on your chest, but we will auscultate your breath sounds. Right middle lobe. And both lobes are clear with no crackles, wheezes, or adventitious sounds. Are you doing okay?
Yeah.
While we're here, we'll also palpate your axillary nodes. Okay. And we'll be moving on to the abdomen, so we're going to have you lay down.
This way.
View. While you're down here, I'm also going to listen to your heart sounds one more time. Aortic, pulmonic, Erb's point, tricuspid, mitral. S1 and S2 can be heard and is regular. I was not able to discern that variable murmur during that auscultation. Now we'll inspect the abdomen, and we're going to auscultate. I don't see any scars, any protrusions. And then positive bowel sounds in all 4 quadrants. We're also going to auscultate the arteries with the bell. And we'll start with aortic, renal, iliac, and femoral. Let's palpate the femoral pulses. And then auscultate. I'm not able to auscultate any bruits. We'll move on to percussion. The abdomen should be tympanic. The gastric bubble is resonant. We'll also palpate, we'll palpate the abdomen in all 4 quadrants. Any tenderness there?
No.
And we will palpate the inguinal nodes. There's no swelling or immobile nodules. Let's percuss for your spleen size. So we are going to be percussing medially of the axillary line. The sound changes from resonant to dull. And I don't suspect any enlargement. We'll also be measuring your liver through percussion. Okay. The sound will change from resonant to dull. And then from dull to resonant. The distance here is 10 centimeters, which is within normal range. We will attempt to palpate some of your internal organs, starting with the spleen. So I'm going to do the hooking technique. Take a deep breath. And I'm looking to see if I can feel the liver edge. Also your kidneys. Okay. And that completes your abdominal exam. You may stand up. You may put your shirt back on. We're going to move on to the peripheral vascular system. So I'm going to be inspecting the skin on your hands, lightly palpating, looking for any scars, lesions, also your lower extremities. And also testing for capillary refill. Less than 2 of the lower extremities. No pedal edema, the skin is pink. Capillary refill is less than 2 seconds in the upper extremities. And we'll be palpating your, starting with your brachial pulse. Radial, ulnar, popliteal, posterior tibialis, and dorsalis pedis. And all pulses are 2+, regular, and bounding. We'll also palpate your epitrochlear nodes. And there's no swelling there. Okay? Move on to your musculoskeletal exam. For this part of the exam, we will ask you to do some movements. We're going to start by asking you to put your hands out in front of you. Up above, out to the side, behind your head, behind your back, and again against resistance. So put your hands out in front of you. Okay. Up. Put your hands up above your head. Out. Behind your head. Push up against me. Behind your back. Push up against me. There you go. Also need you to extend and flex your elbows and against resistance. So extend and flex. Okay. And open your hands. Don't let me close your fingers. Don't let me open them. Give me a thumbs up. Wrist flexion, extension, inversion, exversion, and circles. And again against resistance. Up, down, in, out, and circles. That's all. Good motor strength, equal motor strength. I'm going to ask you to stand and we're going to test your hips. So I need you to do some leg movements with your right leg. Go out, back, in, out, and against resistance. Out, back, in, out. And the other leg. Up, back, in, out, and against resistance. Back, in, out. Okay. And have a seat and flex and extend your knees. So bring them, fold them and then extend them. And then against resistance, so flex and extend. We'll do that with your ankles. Same as we did with your wrists. Up, down, in, out, and against resistance. Up, down, in, out. And with your toes, I want your toes to go up and down and against resistance. Okay. And we'll also palpate your joints. Starting with your shoulder joints, elbow joints, wrists, phalanges, knee joints, ankle, and down at your toes. There's no tenderness. Did any of those hurt? There's no tenderness or swelling to your joints. Let's move on to your neurological exam. This will be the final portion of your exam. I'm going to ask you to remember 3 words. Green, bus, gator. Okay? And tell me who was the first president of the United States.
George Washington.
And what is your birthday?
2/20/92.
So his the long-term memory is intact, and we will be finishing the exam with the long-term memory results. Also, I'm going to ask you to stand. We're going to test your cerebellar function and proprioception. So I'm going to ask you to walk from this stool to that stool. And walk back, heel to toe. Turn around and walk back on your heels only. And turn around and walk back on your toes only. There's no imbalance, and the motor movements were equal. Also, I need you to stand, close your eyes, and hold that pose for 30 seconds. This is going to be testing the Romberg test, which tests for sensory loss and cerebellar dysfunction. Also, put your arms out in front of you, palms up, and he would hold that for 30 seconds. This is the pronator drift test. We're looking for any pronator muscle inversion indicating disequilibrium. And that's status. You can open your eyes. I'm also going to ask you to bend forward. This is part of your musculoskeletal exam, but we want to look at your spine. So we're going to palpate down the vertebrae, looking at shoulder length and hip height, which is equal. So no suspicion for scoliosis or spinal deformity. continuing your neurological exam. You can have a seat. We're going to be testing some sensory functions. So I'm going to ask you to close your eyes, and I'm going to ask you to tell me which finger I'm pulling up.
Right pinky. Left pointer. Right pinky. Foot.
Can you bring your feet out?
Left big toe.
And then if we had a working tuning fork, I would strike the fork and you would tell me where you feel the vibrations.
Right thumb. Left pinky. Right big toe. Left big toe.
Okay? We'll move on to soft touch. Keep your eyes closed and tell me where I'm touching you.
Right wrist. Right foot. Left hand. Left foot.
Okay? And we'll also perform 2-point discrimination. Keep your eyes closed. That's 2 points and that's 1. Okay?
2. 2. 1. 2. 2. 1. 2. 2. 1. 2. 2. 1.
Okay. 2-point discrimination is intact. We'll move on to stereognosis. Keep your eyes closed and I'm going to hand you 2 objects. And tell me what the objects are.
A paperclip in my left hand and a coin in my right hand.
Very good. Trapezesia. I'm going to draw a letter and a number in your hands and you tell me what it is.
T. 2.
Very good. And I'm going to ask you to repeat the 3 words that I gave you at the beginning of this section.
Green Gator school bus.
So that is appropriate long-term memory. So that completes our physical exam today. So in summary, this is a 28-year-old male patient who is here today for no complaints but needed a complete physical exam. He does wear glasses and his vision is corrected to 20/20. There was no head abnormalities, no ear or nose abnormalities. He did have some oral dental caries that have been repaired. The neck had no abnormalities, the nodes, the trachea was midline, cranial nerves were intact. Cranial nerves 1 through 12 were all intact. His chest revealed a congenital diastolic murmur from a ventricular septal repair, which he has a couple scars on his back from. The lungs were clear. The abdomen had positive bowel sounds in all 4 quadrants. The organs were, there was no organomegaly. As far as his skin goes, it was pink. There was no swelling, edema. The pulses were all equal, symmetrical, and bounding within normal range. All his motor movements were 5+. There was no deficits there, no proprioception deficits, no sensory deficits, no hearing loss. And there was a part of the exam that we missed, which would have been the testing for reflexes. So we'll go ahead and do that now. So we would start with the brachial. Relax your arm. Relax your arm. Triceps. Brachioradialis. Patellar. Let your feet hang. Okay. Achilles. And finally, plantar reflex. That completes our exam.